One of the reasons to go with Cerner above any other place would be their experience with rehabilitation facilities and their willingness to listen and provide assistance, areas of improvement, areas where we think that we can take this to the next level, to the next stage.
As our medical field is changing, they really look at bringing the most current research and the most current information to the table. When they provide us with our forms documentation, we can feel comfortable knowing that we're meeting the standards that are out there in our industry.
Inside of rehab, it's very important that that information is appropriately gathered, that from the moment the patient comes into the facility, that the user understands who the patient is, knows the patient, and is able to effectively give them treatment or take information from them. That's one of our guiding principles.
To be able to have the notes from acute rehab before they get there is certainly an amazing piece. And having some of the nursing documentation ahead of time has been very helpful. Because, of course, we would get a paper chart that you would have to search for the information. Now you can just go to the results review and see it right there.
Patients are interacted with in a way that's only conducive to their care. And with our data elements, we're able to share their information with their primary physicians, with their spouse, their caregivers. So whoever the appropriate person is, we can make sure they understand where the patient is and their health journey.
Cerner is helping us with even being able to retrieve the data that we are producing, as well as the data from the other rehabilitation facilities, justifying the place in the post-acute world for rehabilitation.
They recognize the needs of the clinician. They don't just take a nursing form and make it user-friendly for a therapist. They take a form and they make it a therapy form, which I think is great, speaking from a therapist standpoint. When we look at rehabilitation and the ongoing changes in the world of rehab and requirements from Medicare and other insurance companies as well, I really have to value what Cerner does.
Cerner's vision in the rehab space is succinctly to understand transitions of care, understand what makes a rehab unique as a venue, and then both elevate and leverage the One EMR philosophy as well as other Cerner solutions.